Assalamu alaikum. Today I will be demonstrating about the difference between the forced expiratory volume after 1 second, forced vital capacity, and forced expiratory volume percentage. So we will be discussing the difference between the FVC and FEV in both the cases, in the obstructive disease and in the restrictive disease, in both the cases. So first of all, I will tell you about that what is the obstructive disease. So in obstructive disease, suppose this is the trachea and obstruction occur. And if we talk about the restrictive disease, suppose this is the lungs. Let's suppose this is the lungs. Suppose these are the lungs. And what happens that in this particular area, suppose this particular area becomes stiff or fibrosed, and air becomes accumulated in this particular area and cannot be expelled out. So if this area becomes stiff or you can say fibrosed, so this is known as the restrictive disease. Now talking about the FEV1 in the obstructive disease. So the forced expiratory volume after 1 second in the obstructive disease would be very much less. I will demonstrate it by two arrows. Why it would be very much less? Because there is obstruction here and air cannot be expired out. Very minute amount of air can be expired out. So that's why the value of FEV1 in the obstructive disease would be very much less. And talking about the FEV value of the in the restrictive disease, so it would not be very much less, because in this particular area, from this particular area, air can be expelled out. So only in this particular area, from this particular area, air cannot be expelled out. But in this particular area, which you are seeing, that from this particular area the air can be expelled out. So that's why the forced expiratory volume in the restrictive disease would be minutely, you can say, it would not be too much less. Now talking about the forced vital capacity, if you talk about the forced vital capacity, this actually demonstrates about the whole vital capacity of the lungs. So what happens that, suppose this is the trachea, and this is the obstruction. So chemical mediators, due to the release of the chemical mediators, what happens that a small passage develops here, which can allow the air to expire out. So that's why the forced vital capacity in the obstructive disease is not very much less. It is minutely less. And talking about the forced vital capacity in the obstructive disease, so you can see that from this particular area air can be expired out, but air cannot be expired out from this particular area. So that's why the forced vital capacity would be very much less, because this talks about the total vital capacity. So the total vital capacity is affected by this area, because air cannot be expired out from this particular area. So that's why the forced vital capacity is affected, and that's why the value of forced vital capacity in the restrictive disease is very less. Now calculating the percentage. So the forced expiratory volume percentage by this formula, FEV by FVC. We know that in the mathematical formula, according to the rules, if the denominator is large, the value is small. So you can see that FVC is large in the case of obstructive disease, and the FEV is small, so the value is very much less, which is 47 to 20%. So this is the small value, because the denominator is large. And if we talk about the restrictive disease, so in the restrictive disease we put this formula and FVC. So you can see that the value of denominator is small and the value of numerator is large in the restrictive disease. So that's why the value would be greater. Why the value would be greater? Because the denominator is small and the numerator value is large. So this was my basic lecture about the difference between the FEV and the FVC in both the scenarios, in the obstructive disease, in the restrictive disease, and hope you have understood it well. Last but not the least, don't forget to subscribe to MS lectures. Thank you.